Orthopedic surgeons specialize in problems of the musculoskeletal system, basically issues with muscles, bones, ligaments, tendons, anything that helps us move and be active. There are various subspecialties within orthopedic surgery. Some surgeons focus on orthopedic trauma, pediatrics, foot and ankle, and myself, joint replacement. I went to medical school in UC San Diego, and then I moved to Los Angeles where I did my orthopedic surgery residency at UCLA. Basically, that's where we get the brunt of our orthopedic training across all subspecialties. I then went to USC Keck for subspecialization in joint replacement. That's where I honed my skills on primary and revision joint replacement, as well as minimally invasive techniques and faster recovery protocols. Because of my subspecialty training is total joint replacement, most of what I see are hip, knee, and shoulder wear and tear. It's pretty amazing how much our joints can take throughout our lifetimes of pounding and running and beating. And the special material within the joints that makes it happen is cartilage. And when we start losing cartilage, we develop arthritis, and that's the most common ailment I see. Well, when we think of arthritis, we most commonly think of pain, and pain is definitely the primary complaint that most patients come in with when it comes to wear and tear. But stiffness can be another symptom of arthritis. And after a long period of time, that could lead to a loss of range of motion, particularly in mornings and after long periods of rest. Another symptom could be radiating pain. So pain in the thigh or knee, for example, could be a sign of arthritis and pain in the hip. For mild pain or infrequent pain, I think conservative measures would likely be the first best step. So weight loss, proper diet, exercise, and anti-inflammatories can usually take care of the pain. But when things become more debilitating and affect daily life and limit the things that the patient wants to do, it's probably best to come and see what other options we have to offer. Well, the pandemic has put our lives on hold for a lot of reasons. Our social gatherings are limited, gyms are closed, we're staying indoors more often, and this overall has made our lives more sedentary. When we're living with pain from arthritis, that can further negatively impact our well-being. We made tremendous changes here at Emanate Health to keep things safe and clean, and I think it's important not to delay the care for the one other factor that we can change, and that's the pain in our joints. Well, I think sticking to the basics is key. Diet and exercise make a big impact. In terms of exercise, low-impact activities are probably best. Walking, cycling, elliptical, and swimming are all easy on the joints, but promote good cardiovascular health. Avoiding running, excessive jumping is probably better for our joints in the long term. And when it comes to diet, that almost plays a bigger role in losing weight. And every 10 pounds we lose is 40 to 50 pounds off the surface of the joint. It makes a very big difference. Well, when I'm not here on call and I have a free weekend, you can probably find me surfing in the daytime, usually out in Newport. Now I live in Orange County, or cooking pizzas in the evenings. I love Neapolitan pizzas. I have a pizza oven, and that's kind of one of my side passions, is trying to perfect the right dough and recipe.